Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is research in wound care and will be presented by Dr. Alisha Oropallo and Sally Kaplan. Just a few quick notes. This webinar will be recorded and the recording will be available on the CITI program's website. Dr. Alisha Oropallo is the director of the Comprehensive Wound Healing Center. She's an associate professor at Zucker Hofstra School of Medicine and Feinstein Institutes of Medical Research. She has been the lead investigator on clinical trials, published papers, and has been invited to lecture in wound healing globally. Sally Kaplan is a research nurse specialist at the Northwell Health System. Sally facilitates investigator-initiated and industry-sponsored clinical trials for the Department of Surgery, particularly in the specialty of wound care, with Dr. Oropallo, who serves as the director of the Northwell Comprehensive Wound Healing Center.
So today's learning objectives, we're going to describe the process on how to onboard new research, identify the challenges behind grant negotiations, and determine if new protocols meet your needs.
So with industry-sponsored studies, the way we go about starting this study is to submit to Brainy for only our industry-sponsored studies. All the departments work together at once, and there's a group working on our budget and a group working on our IRB application and a group reviewing the consent and the attorneys looking at the contract. So it all comes together pretty much at the same time. As soon as we receive IRB approval, we can have the site initiation visit from the sponsor, and they'll come and assess where we're doing the research, and they tell us more in depth about the study, and they will also work on finishing up the contract and the budget before we can actually get started. If we're working with Brainy for industry-sponsored studies, we have to apply to the Northwell IRB for institutional approval as well. For industry-sponsored studies, with the grant application, sometimes the industry gets money from the National Institutes of Health or the Department of Defense, and they give us a subaward agreement so that they can use some of that money for their industry-sponsored study and prepare multi-centers around the country to do the research. So we use the Grants Management Office at Northwell to help us with the process. And some studies don't require a budget. Like case reports, we can do without IRB approval. We can observe up to 3 patients and report out and write an abstract for conferences based on case reports. In summary, conducting research in wound care, you can utilize an organized workflow to onboard new research studies. Actually, the Office of Clinical Research at Northwell has a wonderful document. It's called Industry-Sponsored Studies Startup Checklist, and it's a checklist of everything that you need to know and get done to do your study. Every institution has a grants office, and their IRB has a budget negotiation team. So become familiar with these important people in doing your budgets. You want to ensure that you have the resources to complete the study. We're fortunate enough to have a research nurse and 2 research coordinators, along with Dr. Oropallo, 2 other general surgeons participating, and 4 podiatrists and 2 nurse practitioners to participate in doing the research. And overall, research helps to achieve better patient outcomes, and patients are happy to participate.
I would like to thank both of our presenters for today's presentation. Thank you and goodbye.